What's up, folks? Are you dealing with a pesky disc bulge or neck pain that just won't quit? If so, you might be wondering about chiropractic treatment. Some people swear by it, while others are skeptical. So, is it good or bad? In this video, we'll dive into the world of chiropractic treatment and its effectiveness for disc bulge and neck pain. So, whether you're a believer or a doubter, join us on this wild ride, and let's find out if chiropractic treatment is the cool cat you've been looking for. Chiropractic treatment is a form of alternative medicine that focuses on the diagnosis and treatment of musculoskeletal disorders, particularly those related to the spine. The practice involves the manual adjustment and manipulation of the spine and other joints in order to alleviate pain and improve mobility. Chiropractic treatment has been a subject of debate, with some proponents lauding its benefits while others remain skeptical of its efficacy. In this video, we will explore the arguments for and against chiropractic treatment, particularly in the context of disc bulge and neck pain. Firstly, let us consider the potential benefits of chiropractic treatment. Proponents of chiropractic treatment argue that it can be an effective alternative to conventional medicine for the treatment of musculoskeletal disorders. Chiropractors use various techniques to adjust the spine and other joints, such as spinal manipulation, mobilization, and soft tissue therapy, to alleviate pain and improve mobility. Chiropractic treatment has been found to be particularly effective for lower back pain, neck pain, and headaches. Studies have shown that chiropractic treatment can lead to significant improvements in pain, disability, and quality of life in patients with these conditions. In the context of disc bulges, chiropractic treatment can be an effective option for some patients. Disc bulge, also known as a herniated disc, is a common condition that happens when a portion of the spinal disc protrudes and presses on nearby nerves. This can cause pain, numbness, and weakness in the affected area. Chiropractic treatment can help to alleviate the symptoms of disc bulge by reducing the pressure on the affected nerve and improving the mobility of the spine. Chiropractors may use techniques such as spinal manipulation, flexion distraction, and spinal decompression to treat disc bulges. Similarly, chiropractic treatment can be effective for neck pain. Neck pain is a common condition that can be caused by a range of factors, including poor posture, injury, and stress. Chiropractic treatment can help to alleviate neck pain by adjusting the spine and improving the alignment of the neck and shoulders. Chiropractors may use techniques such as spinal manipulation, mobilization, and soft tissue therapy to treat neck pain. However, critics of chiropractic treatment argue that it can be ineffective or even harmful in some cases. One of the main concerns with chiropractic treatment is the risk of injury. Manipulating the spine and other joints can put pressure on the nerves and tissues, which can lead to injury. While serious injuries are rare, they can occur, particularly in patients with underlying conditions such as osteoporosis or spinal cord compression. Another concern with chiropractic treatment is the lack of regulation and standardization in the field. Chiropractors are not regulated in the same way as medical doctors, and there is no standardized training or licensing process for chiropractors. This can make it difficult for patients to know whether a chiropractor is qualified and experienced enough to provide safe and effective treatment. In conclusion, chiropractic treatment can be an effective alternative to conventional medicine for the treatment of musculoskeletal disorders, particularly in the context of disc bulges and neck pain. However, there are also risks associated with chiropractic treatment, including the risk of injury and the lack of regulation and standardization in the field. Patients considering chiropractic treatment should weigh the potential benefits and risks and consult with a qualified and experienced chiropractor. It is also important for policymakers to consider regulating and standardizing the chiropractic field to ensure the safety and effectiveness of the practice. Disc bulge, neck pain chiropractic treatment, spine adjustment. For disc bulges, chiropractors may use spinal manipulation, flexion distraction, and spinal decompression techniques to alleviate pain and pressure on the affected nerve. These techniques involve manually adjusting the spine to reduce the pressure on the affected disc and allow it to heal. Additionally, chiropractors may recommend exercises and lifestyle modifications to help strengthen the muscles and improve the alignment of the spine. For neck pain, Chiropractors may use spinal manipulation, mobilization, and soft tissue therapy to alleviate pain and improve mobility. These techniques involve manually adjusting the spine and soft tissues of the neck to improve alignment and reduce tension. Additionally, chiropractors may recommend exercises and stretches to help strengthen the muscles and improve posture. To stay up to date with our latest videos, make sure to subscribe and press the notification bell button to get some interesting stuff and upcoming videos. Spine adjustment, which is a core component of chiropractic treatment, involves manually adjusting the spine to improve alignment and mobility. Chiropractors use a variety of techniques to adjust the spine, including spinal manipulation, mobilization, and soft tissue therapy. These techniques can be used to treat a range of conditions, including back pain, neck pain, headaches, and joint pain. Overall, chiropractic treatment can be an effective option for patients with disc bulges, neck pain, and other musculoskeletal conditions. However, it is important for patients to consult with a qualified and experienced chiropractor to determine if chiropractic treatment is right for them and to receive safe and effective care. However, it's important to remember that chiropractic care is not a one-size-fits-all solution and may not be suitable for everyone. While some people have reported significant improvements in their symptoms after receiving chiropractic adjustments, there is still a lack of conclusive scientific evidence to support the effectiveness of chiropractic care for certain conditions. As with any medical treatment, it's crucial to weigh the potential benefits and risks carefully. And that's a wrap, folks. We've delved into the world of chiropractic treatment and explored the question of whether it's good or bad. Whether you're dealing with a disc bulge, neck pain, or spine-related issues, it's clear that chiropractic care can be an effective option for some people. However, as we've learned, it's important to approach chiropractic treatment with caution and consult with a licensed chiropractor before making any decisions. While some people have reported significant improvements in their symptoms after receiving chiropractic adjustments, there is still a lack of conclusive scientific evidence to support the effectiveness of chiropractic care for certain conditions. So, whether you're a believer in chiropractic treatment or still on the fence, it's essential to do your research and consider your individual circumstances before making any decisions. Thanks for tuning in, and we'll see you in the next video. And please share our videos with your friends to support our team. Looking for more amazing videos? Check out the videos popping up on the right and the left of your screen. Thank you, guys.